Yes, Cheryl, your slides are now visible. You can start your presentation.
Okay, I've just got to make them bigger. Sorry, I can't actually see them very well. For some reason, they're not coming up big. Just give me a minute. Okay, got it. Oh, dear, I do apologise, everyone. All right, I'm going to go back a little bit, if I can.
Cheryl, kindly unmute yourself.
I'm sorry, I'm trying to get it to full screen, and for some reason I'm just having all sorts of problems today. There we go. Okay. My apologies, everyone. I do apologise about that. Okay. So, next slide. Okay, I'm trying to work out how to advance it now that the screen's bigger. I'm so sorry, guys. I'm just having so much problems with this today. I can't seem to make it advance. Oh, there we go. Okay, so I joined a support group because I wanted to help other people having got good results for myself. So the Eczema Association is a wonderful support group. We know that eczema is more than just skin. It's support and education for eczema sufferers. Sorry, it's going too fast now. Does anyone know how I can pause it? Seeing as I can't seem to work any of the buttons on my computer. Is it possible for you guys to share it for me? And then I'm so sorry about this, everyone. Okay, I'm going to start again. All right, I'm back to this, but I can't seem to advance or backtrack it. Does anyone know how to help me do that? Or how to pause it? Here we go. Sorry, I got it. Okay. We only missed a bit about the Eczema Association being a really great support group. We provide educational information. So if you go on to whatever practice you're in, if you have the chance to support a support group or set up one, please go ahead and do it. We work with a lot of international organisations, Global Skin, which is International Alliance of Dermatology Patient Organisations. I was an executive board member for 7 years. Also Global Allergy and Airways, Skin Health Institute in Victoria, and the Global Patient Initiative to Improve Eczema Care, which are all global organisations working to help people with not only eczema but other skin diseases. Okay, next slide if I can get to it. Right, so we're supported by many corporate members. These are usually pharmaceutical companies that help us to do educational programs, attend expos, talk to members of the public. So it's really important that we get that support. Nobody can survive in this day and age without having some financial support. So we really appreciate their help. We also get some support from the government, from Queensland Government, because we're based in Queensland, but we are a national organisation. And it's very, very helpful to get that help. We produce lots of educational information, brochures, an eczema care plan you can take along to your doctor or pharmacist, information sheets, and we have lots of posters just trying to raise awareness of the plight of eczema sufferers. Advocacy is just one of those things that goes on all the time in every area of what we do. But at the end of the day, people just want someone who's empathetic, caring, and knows what they're talking about to talk to, maybe on the end of the phone or via email. Lots of our patients go along to their dermatologist or their health provider. They don't have a lot of time to spend, and they don't give them a lot of backup information, which can be really helpful in managing your eczema on a day-to-day basis. We also produce the only dedicated magazine for eczema sufferers in Australia and New Zealand, and this is wonderful. We get a lot of feedback from our members. We include, specialised recipes for people that have allergies. Of course, not all eczema sufferers do have allergies. We talk about the best type of clothing, just little handy tips. We also work with the College of Dermatology in Australia, and they write an expert article for us for each edition. We only produce 4 a year, but it's a really great to have something that's specifically tailored for people who have this really debilitating skin disease. We also have lots of social media channels, and we put up tips on them on a regular basis, a few times a week. TikTok's a bit new, but we're working on that. If anyone wants to check out our TikTok platform, which is Eczema AU, I have a really cute video of putting cream on my cat. My cat also has eczema, so I have to treat him like you would another member of the family or yourself. He hates getting his cream on too, I must say. Every year we run 3 or 4 webinars, and we really bear down or talk specifically about things that are really important at different times of the year. So coming up in December, we're having a webinar both for New Zealand and Australia with specialists from both countries talking about treatments. We know that treatment options vary very much around the world, so it's really key at the moment to let people know what's available for them in their country, because it does vary a lot depending on your government support for funding treatments. I mean, it's great to have new treatments, but they need to be funded so they're accessible for everyone. We also might just do webinars on, like eczema and festivities. How do you cope during something like Christmas? For the last few years, the Eczema Association has presented a funding grant administered by the College of Dermatology for some sort of research specifically for Australia. So this is actually our second grant recipient. We congratulate her, and we want to see more study and research going on in that particular country where the patient support group is based, that we can then go on and use to help put what treatments need to be done forward. So it does help tailor what treatments people are looking at specialising in. Pharmaceutical companies and that, they need to have some sort of direction to go. So these sort of grants, it's not a huge amount of money, but it's something we feel very privileged to do, and we're hoping to keep doing it for the future. Also every year, the Eczema Association hosts groups of medical students from a local university. They come in, they learn about what we do, they learn a bit about eczema. It's only their first year, so they don't know much. But we've been doing this for 10 years now. We have about 6 or 7 lots of students every year. They go away with a goodie bag, and we do lots of fun things as well as lots of serious stuff. I have some presentations from dermatologists I show them. And there's a lot of feedback and just a lot of talk about how to manage patients better, whatever type of practice you get into. We really need better communication between health professionals and patients, so that this then leads to a better outcome. Every year we run 2 big awareness campaigns. So we run Eczema Awareness Month in May. May in this part of the world is very dry and cold, and a lot of people who have managed their eczema quite well over the warmer months really can have a severe flare just because of the dryness. And we also run World Atopic Eczema Day in September, which used to be Eczema Awareness Day, but now we join in with the rest of the world. It was an initiative started by Global Skin. And we try and use our organisation as a platform to really reach out to people and let them know what's available treatment-wise and that we're there to help them. So this can include videos from patients, things that really, you can really look at and understand how eczema sufferers manage their daily life. So last year for Eczema Awareness Month, we actually concentrated on carers and eczema, because we know it's terrible when you have eczema, but for many families, it's actually the carer who bears the brunt of just as much impact as the sufferer. So, when you have a child, or an adult with eczema in your household, you not only have to look after yourself, you have to look after that eczema sufferer, and it can be really, really stressful. We know that there's a lot of stuff with eczema management that you need to do. So the webinar we hosted during this time featured dermatology experts, Dr. Kate D'Ambrosis, who's on our medical advisory board. We did skip over that one. We do have a medical advisory board. We have a compounding pharmacist, 2 dermatologists, and also a nurse practitioner. And they help us on a day-to-day basis with medical questions. We never answer medical questions. We refer to them. So caregivers, 33% of caregivers, we did a little survey, spend over 11 hours on eczema management. And that's not even looking after themselves, it's for their eczema patient. So, we know that eczema's true burden is often not seen, but, it really has a wide-ranging and long-lasting effect on the family. Caregivers often get quite stressed, almost as much as to the extent that the eczema sufferer gets stressed. So we need to sort of think about them. So, even for patients who have their eczema under control mostly, they can still have long-term self-esteem problems, and this can affect the rest of their family. So we know that counselling can benefit eczema sufferers. A psychologist can teach them, behaviours that can help with, things that they do like scratching. We know that most eczema sufferers scratch more than they really need to because it's habit forming. But, really the whole family needs to be involved in this process. So often they don't need to go to a psychologist or a counsellor long term. Just sometimes they go through a really stressful time, often when the sufferers had a really bad flare, and the whole family seems to be just overtaken by this condition, which is really debilitating. So, ask your health provider. So if you as health professionals don't have that information, find it out. Have it ready to pass on to patients because they need as much help as they can get. We know that eczema is just not a one type of disease. It's it does affect the whole body, not just the skin. Of course, it's the most common inflammatory skin condition in adults and children. Patients find this terminology confusing, but understand the word atopic eczema. So that's what worldwide we've been trying to do, just use that term. So we know that 1 in 3 babies develop eczema, atopic eczema, I should say, between the ages of 3 and 6 months. So it's very, very common. We know there is a genetic link, but there's a lot of other things that run into play too, environmental allergens. We need more research to pinpoint exactly why this happens. Many babies will start getting eczema when they start teething because they can get a bit stressed with teething. So, of course, managing atopic eczema to prevent flares, it's a constant ongoing battle and it just never really ends, and it has a major impact on their daily lives. We don't really understand atopic eczema, but we do know it can exact a really significant physical and emotional toll on sufferers and their carers, and it's the quality of life we're talking about. Also, treatment information can be conflicting and very variable. Everyone Googles themselves these days and what their diagnosis is, but that often leads to more confusion. So we always recommend that everyone visit their dermatologist visit their GP and get a referral to a dermatologist and get a proper diagnosis. That's number one. But emotional well-being, it really is hard. If you wake up through the night and you're intensely itchy and you can't seem to get on top of that itchiness, it means you're not sleeping, then you've got to go to work the next day. And it creates its own anxiety and stress. The itchier it gets, the more you stress about it. The more you stress about it, the itchier it gets. It's like this terrible circle that you just can't seem to break. So we need to find ways that are more effective to help break that cycle. We know that people who have a little bit of success with something, it really mentally empowers them to keep going and then to, actually reach better success. So we need to find some sort of program where we can implement these steps that we take to really help relieve people's anxiety about when they experience a flare. Unfortunately, it's different for every person. And even people who have really mild atopic eczema can get really stressed about it. You get that sinking feeling, oh, here we go again, and you know what you're in for. Excuse me. There's no cure for eczema, but we know it can be well controlled. So even though it's common for it to change, the severity, it's really important to control it the minute you notice it. So just, talk to your health professional, work with them. So these are some of the common external triggers: tobacco smoke, animals, it's the dander off their skin, grasses and pollen, especially at times like spring, sand, stuffed toys overheating, some jewellery, cosmetics. So it's more expensive to manage anyway because you have to buy specialised products. Also, we know that eczema sufferers often have allergies, but they don't all have allergies. And it's really difficult. You can test for allergies, but you can't really test for intolerances. So I advise people actually to keep a diary. But these are some of the common internal things that people can react to and may have allergies to. So we did an impact report a few years ago now, and these are some of the stats that we came up with. Weather can be a trigger. Only 6% said their eczema was controllable, which is really appalling. 52% said it was chronic. And, it's expensive. So, of course, research is starting to provide some better treatments, but we need access to them. We like to encourage our patient members to participate in trials. This is the way we're going to get better treatments more affordable for the future. So we're a great platform if companies have trials. We work with a lot of medical companies and we post their trials on our websites and social media. So this is a global study we were involved in, and pretty much worldwide, stats are the same. Satisfaction with eczema treatments, impacts on health-related quality of life. So as you can see, there's a little bit of difference, but, most people would trade off that much % of their life to have better eczema management. So it really hits home a lot. And then we know that moderate to severe atopic eczema is complex and chronic. So shared decision-making really leads to better outcomes. And you can see that the United States is a bit of a standout there, but that's probably because they have the highest amount of eczema sufferers. But it does show that they are more involved in shared decision-making. So that's a good rule for the rest of the world. So as we know, eczema can be really depressing to cope with. It relapses. You get stigmatisation because it looks terrible. And, the psychiatric comorbidities are really horrendous. We recently had one of our members take his own life. So this is an ongoing thing. People with really severe eczema that don't seem to feel as though they can get any help, they are at risk. So that's why it's really important to refer them on to get more help, especially when we start to notice that they're not doing as well. For example, they might be not doing as well at school. It's really a red flag to say we need to do more here. We don't know the exact mechanism, but we know that, really people with eczema have a poor body image, and suffering from that systemic inflammation. There are some studies saying that we need to look at that more, and it could have something to do with the way our brain processes things. So that's really important, and maybe research for the future. So, you know, if you have a great doctor you can work with and feel as though you'll listen to, it can really have a good play out on your mental health. So that's why it's really important that you guys, as doctors, find ways to help your eczema sufferers more than maybe you do now, or than you thought you might need to. So there's also things that patients with eczema and their families can do. They can have more say in the treatment options, have more conversations with the doctors rather than just being told this is what to do. And that can really facilitate them managing better overall with their mental health. In turn, that will affect their physical health, which then affects their skin. So joining an eczema support group, it's a really valuable way of normalising. You know, you've got eczema, but so have all these other people, so you're not quite so different, because everyone feels as though they're suffering alone. You know, and exchanging stories, news and ideas is great to just help people with eczema feel more connected and not like they're battling this all on their own. Also, you know, education. We just need more to up our education, try and do more if we possibly can, and try and make patients feel as though it's not embarrassing and there's lots of people with eczema. And that's why sharing videos and that type of thing when we do our awareness programs is really, really important. There is a new field called psychodermatology. I won't go on and on, but it's very hard to find a psychodermatologist, but this is a dermatologist who has some psychology training, and we're finding that they are a great fit for a lot of skin diseases. So when you typically visit your dermatologist, they focus just on the skin disease, but a psychodermatologist also does that, but focuses as well on the mental and emotional side of the condition and tries to treat the whole person, not just the skin condition. And this is what we're finding is really important for eczema patients to get long-term management. So, as I said, it can be hard finding a psychodermatologist, but if we could train more psychodermatologists, we would get much better results for most eczema patients. Even those who find a psychologist themselves, maybe through their local health practitioner, often have really good results. So we know that this is a great path to set eczema patients on, you know, to help them with their long-term management. So education really provides lots of tools. And as I said, working as a team with the health professional and the whole family can be really beneficial. Shared decision-making in treatment. People are very scared of a lot of treatments, so the more discussion you have, the more information they have, the better. And acknowledging that skin issues can be more than skin deep. So spreading awareness about that is probably the key point. We need to treat the person as a whole patient, not just look at their skin and treat it. So advocacy goes on all the time globally to support more services for this skin disease, especially funding new treatments. Team-based care can improve healthcare overall. And patient support groups are a vital part of this process. So help set one up in your area if you don't have one. So thank you so much, everyone, for bearing with me. I really apologise about all the technical dramas. And what I'd like to say is that if anyone's got any questions or wants to know any more information, I'd be more than happy for you to email me and I'll answer to the best of my knowledge. Hope the rest of your seminar goes really well, and thank you again for having me. Bye, everybody.
Hi, Cheryl.